Hi Graham, I'm Alex, as you know. I'm one of the haematology regs up here in the North East, and we're going to have a chat today just a bit about your career in haematology, how you've seen it change through the time you've been working, and then go on to what you see for the future of haematology with the BSH 60-year celebrations in mind. So would you mind just starting by introducing yourself and talking about your specialism within haematology?
Okay, so I'm Graham Jackson. I'm a consultant haematologist here in Newcastle, and I've been doing haematology for 35 years. It's a subject that's always fascinated me from the word go, right from being a medical student. We got great teaching. I then was lucky enough to do a haematology house job, haematology SHO job, obviously F1, F2 in modern language, and then did a little bit more general medicine, but always wanted to get back into haematology. And since then, I've, apart from a number of secondments, worked my way up through haematology here in Newcastle. And I've been a consultant here, as you know, for over 24 years now. So I'm getting a bit long in the tooth.
Fine. So in terms of anything in particular that triggered your interest in haematology, was there any individuals or was it any particular elements of haematology that you found particularly interesting?
I think it's just that marriage of great science, difficult patients, and also that ability to make the diagnosis, the lab work as well. And for me, it has always seemed to be the best specialty.
I'd agree. Yeah. So you're famous around here for your 7:30 a.m. morning ward rounds. What is it that gives you the energy to keep coming in every ward round day for that time to get to see the patients?
Well, first of all, I always have a philosophy that you never know what the day's going to bring. So if you get your work out of the way as quickly as possible, then you can cope with whatever emergencies come along. And as my wife will tell you, I'm an annoyingly early person anyway. But I think in the end, Alex, it's the patients. We see some really difficult stuff. We see some patients with some horrible illnesses facing the worst of times. And again, there's several things I think that strike you. First of all, that great strength of human nature, that they are tough people and they fight so hard, and it's almost a privilege to try and help them. And you realise that things have gone wrong, and you're in an amazing position not only to help them with the medicine you practice, but maybe the odd word or two just to encourage them along the way, to help their families. And the other thing I think that's always struck me about haematology is it attracts like-minded people. And we've always had a fantastic nursing team here in Newcastle. All of the registrars that come through have always been excellent, and I have great consultant colleagues, so I think you have a common purpose as well. So I think the culmination of that answer is that I've always enjoyed getting up and going to work.
And linking in with what you were saying there, I think there is something special about the relationship between a haematologist and their patient, because I think we do have, especially in oncology, a very intense relationship with the patients. We often get to know them when they're very ill. We've got to break bad news to them, and they're usually in with us for quite a while for inpatient stays. And do you think that just keeps giving you the reward from the job, because that's something that you can always get something back from?
I think it's a reward, but it certainly keeps you on your toes, because you've got to be honest with people all the way through. And that relationship can be incredibly rewarding, particularly if patients do very, very well. But I think what we have to understand is that when patients come in and feel very threatened by whatever illness they're facing, they need to trust you. And I think you have to be honest from the start. And I think any relationship starts with honesty and being straight, but communicating well. That relationship will always be good.
Yeah, no, absolutely. So just thinking about your career itself, are there any particular moments that stand out for you as things that you were particularly proud of, or things from which you got a really big reward?
I've been very lucky to have some highs in my career. I've been president of the BSH, and I also was given the BSH gold medal for my work in myeloma. Those are incredibly proud moments, although of course all of those things come from teamwork. So although it's me getting the accolade, I think it also reflects the people who are around you and help you. I think I was very proud of the work I did on the BSH committee, not just as president, but as treasurer and as a committee member. I think the BSH embodies all of that we love about haematology and promotes our subject in a very, very positive way. And of course, the annual scientific meetings are a chance not only to reflect on the science of haematology, but a great chance to meet friends who you make. And again, one of the rewards of the career, if you like, is you don't only have your friends at work here, but you have your friends around the country. And you will know this, the people you train with scatter, and you get to know people in every city who are like-minded and who want to push things forward. And it's that chance to collaborate across the country that I like too.
So to think a bit about the patient experience that you've seen through your career, so over your time working in the field of myeloma, what do you think has been the biggest advancement in terms of the patient experience when going through their therapy? Not necessarily the treatment, but that sort of holistic element of it.
A very important difference has been the advent of clinical nurse specialists. I think in general, over the last 30 years, communication with patients is much, much better. We've changed from being very paternalistic to very inclusive. The patient is the centre of everything. The other thing I think we've seen in myeloma is the advent of the Myeloma UK charity, which provides patients with excellent information. Even with all the advances in the treatment, you'll meet a nurse specialist, you'll get fantastic and well rehearsed and informed information, and you will get the chance to communicate with a consultant who will be very interested in your disease.
So thinking about how patients are now better informed, which is critical, it really helps with their understanding of their disease and the treatment that they're going through. Do you find that sometimes it's difficult for patients who may come across news articles, for example, things on the internet that explain about novel treatments that are available that aren't quite here yet in the UK, for example, or are still in early stage trials? Can that also be challenging for them when they don't know whether that is something that might be able to help them or not?
I think there is certainly some truth in that. I think first of all, sometimes newspapers are obviously very guilty of hyping up a story where there may be no substance, and also giving false hope, and we have to guard against that and explain the science behind what they might be saying. One of the clear ways of getting around that is to have as many clinical trials open as you possibly can, because that often allows patients access to drugs that aren't licensed. So I think that's a way around it. And I think as a myeloma community, we've worked very hard and very cohesively to get drugs from license to the patient really quite quickly.
So Graham, what do you think are the most significant developments in myeloma at the moment in terms of therapies, novel therapies, and the role of CAR T cells?
So over the length of 30 years, we've seen bisphosphonates, KERM, we've seen thalidomide, we've seen Velcade, Revlimid, pomalidomide, ixazomib, carfilzomib, and the list of drugs that keep coming through for myeloma is really impressive. I think into that fits the CAR T cell paradigm. Clearly CAR T cells are active in multiple myeloma, but what is interesting is that's part of exploiting the immune system in multiple myeloma and having an anti-BCMA strategy. And I think there are other ways of doing that too. So drug conjugates and BiTE antibody technology. So I think what's amazing is we already think we've had a really exciting time in multiple myeloma, but the future looks even more exciting, and it excites me. Not just CAR T cells, but all of the novel ways in which we can harness the immune system to beat this disease.
Absolutely. And obviously toxicity is always something that we're wanting to avoid with our treatments, and you do a lot of work in lymphoma as well. And so CAR T cells there, they obviously have their risks when they're first introduced to the patient, but going forward, do you see them as a more sustainable way of treating patients?
It's again a very, very good question. I think we're just scratching the surface in terms of the CAR T cell story, and you can even see every unit that uses them is on a steep learning curve of how to handle some of the toxicities, and we have to be honest, some of the toxicities can be quite difficult and can be quite scary, I think, for the patients at times. We're just at the very beginning of that technology. I think what we're establishing at the moment is proof of principle. It works. We now need to establish how we get it to work safely. And as you know, at the moment, we're tending to use this therapy in patients who've had a lot of therapy. So they're often poorly, they're often slightly beaten up by all of the treatments they've had before. So we're testing it in a very difficult group of patients with very resistant disease and seeing occasionally some really spectacular results.
Who do you think have been significant members of the haematology community, not necessarily just to your practice, but to haematology as a whole?
Oh wow! I think one of the attractions to haematology was some huge personalities with great brains in haematology. There always have been. I think the people that always impress me are people like David Lynch, Adrian Newlands, John Goldman, people who've really led the way in their disease areas. Steve Skye, who I worked with in myeloma, Tony Child, who I worked with in myeloma, really inspirational people. And I think the great thing about haematology is that there always seems to be these great people coming along. David Grimwade was younger, but did some amazing work in APML. Sadly not with us, but gosh, what a brain, and what a lovely collaborative guy too. So there have been so many people that have impressed me. It's almost difficult. It's a bit like saying thank you to loads of people, because there are so many people like Charles Craddock. You could keep naming them that are impressive. Simon Rule, they just keep tripping off your tongue. People who are smart, hardworking, driven to make things better. I think our specialty, fortunately, has been full of those people, is full of those people, and will carry on being full of those people.
Absolutely. So if we've got someone who's thinking about a career in haematology, what advice would you give to them?
If I met someone who's thinking about a career in haematology, the first thing I'd say is do it. The second thing I'd say is it's not as difficult as it looks. And the third thing I'd say to them is look at the people who are doing haematology still. They're still enthusiastic, they still love their specialty, they're still passionate about it. And if you look at what you might be in 10 or 20 years, you will probably see someone who still loves coming to work.
And then finally, thinking about sort of keeping yourself sane alongside all of the work that you do, what would your tips be to anyone coming into haematology, which is obviously a great specialty but does have sometimes a bit of an emotional burden and it can be busy? What do you do in your free time to help let off steam?
I think that's a really important question, because you're right, haematology has some sad moments, and we're all people where it scars us. And I often use an analogy, which you might like, which, you know, if you're a plumber or someone who works in woodwork, you'll have scars all over your hands from all of the times you've banged yourself with a hammer and stuff. And I think sometimes we have a lot of scars on our heart that aren't visible, but patients whose journeys have particularly touched us. So I think it is important to have something outside of work. I think we've already discussed it, but teamwork is important too. And for me, my colleagues all the way through my career have been phenomenally supportive, kind, helpful, and friendly, and friends. But you know me. For me, my pièce de résistance is exercise. I love cycling. So going out and cycling 40 miles is a great antidote to what can be a tough day at work.
So just sort of as a last question, if you were to summarise haematology in a sentence, what would you say?
I would say haematology is the most wonderful, challenging, amazing, beguiling, fantastic specialty.
Very well put. Okay, well, thanks very much for that, Graham. It's been good to catch up and hear a lot about your career and where you think haematology is going and the role BSH has played. And I'll see you at 7:30 for a award round.
Alex, it's always great talking to you too, buddy. Thank you.